So I will start by introducing Dr. Samir Gaggar. Dr. Samir Gaggar is a very senior gastroenterologist with our hospital at Reliance Foundation Hospital. He's been there since the inception of the hospital. So we have worked together for more than 8 years. And last 2 years, we have also been neighbors. So, and his wife also works as a physician with us. And she's also a fantastic physician. And she also is my doctor. So we're very close working as well as personal relationship with Dr. Gaggar. And one thing about Dr. Gaggar is that, of course, he's a very competent and highly trained physician, but he's also a very nice person. You go and meet him, and you feel like half your things are already sorted just by meeting him. So that's the beauty of having Dr. Gaggar as your gastroenterologist. So we thought that actually Mazabin came up with this idea that let's talk about how do we take care of our health in monsoon, because while all of us need to be careful, especially for people who have been through different cancers, have taken chemotherapy, radiotherapy, surgery, you need to be even more careful to avoid infections and problems. So we thought Dr. Gaggar would be the best person to tell us about what we should and should not do in the monsoon season, and accordingly we can look after that. And as I said, I'm recording this live on YouTube, and we'll share the link with you, so you can also then forward it to your family and friends and colleagues and whosoever for their own benefits. Okay. So
Thanks.
Mazabine has also just joined. She was in some other meeting. She's managed to just quickly hop into this meeting. So Mazabine, have we told on the group also that we are starting? So many people on the group also would
I'll
then
just I'll just drop a reminder once again.
yeah.
Yesterday.
Prasad, can you see my presentation at all or no? Sorry.
We are not able to see your presentation, Samir.
Okay, just hold on here. Sorry.
So do you need any help with this? Shall I bring you the laptop over there if that helps you better?
Yeah, if you can do that, because I'm just struggling with this here. So
Sure. Just give me 2 minutes. I'll come in. Which room are you in, sir?
Room 324.
324. Yeah. That's tower, right?
Tower building, 3rd floor. It'll be great.
Oh, I'll be there. I'll be there.
Yeah.
So while we set up the logistics for Dr. Gaggar, Mazabine and I are also sort of working on how do we increase our participation in the cancer support group and what sort of meetings we should hold. We tried sort of holding offline meetings, but it became a little difficult logistically for us. But that's there at the back of our mind. So if any one of you has a suggestion as to how do we encourage more people to join, or what are the activities that you would like to participate in, or what are the talks that you would like to listen, we would really appreciate your feedback. So till Dr. Gaggar is setting up his computer, if you have anything to say, please do share. Samir, then in that case, do you want to start sort of your talk, and then the slides can join in later? Samir, can you hear me? You're on mute. Yeah, so we have more people joining in now. Dr. Sameer, can you unmute yourself? Yeah.
So what my presentation was is on briefly on monsoon and gut, and then I wanted to speak something about the gut health. What is good gut hygiene, and what is processed food and ultra processed food, things like that. You can hear me, all of you? Yeah.
Yeah, we can.
Yes, yes, we can hear you. Yeah.
Right. So, uh, the lady was asking that why in monsoon season we get lot more diarrhea, episodes of diarrhea. Okay. One is to do with the weather. I think there is a lot of dampness in the air, and of course, the bacteria and the viruses tend to sit on the food particles and on our hands and clothes for a longer time, and higher chances of us getting those infections. All right. So that's one of the reasons why we end up having more infections in the thing. And of course, monsoon being monsoon, of course we like tasty food. I guess many of us do, and that itself can contribute to the infections. Okay. And of course the general idea is that you avoid any street food. Okay. Because the type of water they use, how frequently they wash their hands, things like that become very important, and how fresh are the food that they use to prepare. Okay. um, uh, the common symptoms that we get is what are the types of names that you hear during monsoon? Any ideas? You keep on hearing certain words or medical terms. So something like gastro and jaundice and typhoid and fever, things like that. So just briefly about the medical background. So jaundice, of course, is a symptom. All right, it is not a disease, and of course, you can have jaundice because of very many reasons. Okay. The commonest in the monsoon season are what we call hepatitis. Yeah. So you can have two types of hepatitis which are very common in monsoon season, and one is hepatitis A and one is hepatitis E. Okay. Now, the thing with this hepatitis infection is that ऐसा नहीं कि आज आपने खाया और आज ही आपको हो जाएगा. Okay. It takes a few weeks for the virus to kick in, affect your liver, and cause jaundice. So when the liver becomes sick, okay, you lose your appetite, you have fever, you have a lot of malaise, fatigue, tiredness, and in very severe cases, you become jaundiced. Okay. And if you check your bloods, your bilirubin is high, which is responsible for jaundice. Your SGOT, SGPT is high. So she's on the. I just switch to. Just stop this. Presentation आ जाएगा क्या? The presentation is. Just
Yeah.
1 second. Sorry.
It's better view.
Guys, just give us 1 minute, huh? So guys, I'm just putting up the presentation. Please tell me if you can see it. Okay, somebody was going to have to unmute and tell me that. Is it visible?
Yeah.
Yes, yes, yes.
Yes.
Great. Now is it visible?
Yes.
Yes.
Okay.
Can you read what's on the screen right now? Has the screen changed for you?
Popular
I think
monsoon
popular
Okay.
blood cell.
Okay, thanks a lot. Sit here. Thanks, Nazarene. Okay. So yeah, just again very briefly. So what are popular monsoon foods? We know that it's chai, it's bhajia, it's vada pav, and pakoda bread, and pani puris, and okay, correct? Yeah. So, and again, as I was saying, what are the popular monsoon names for the medicine doctors? There's gastro, jaundice, diarrhea, dysentery, hepatitis, typhoid, food poisoning. Okay, this I already discussed. So what is jaundice? As I said, jaundice is yellow discoloration of the eyes and skin, and it's a sign of the hepatitis, so something affecting your liver. And as I said before, hepatitis A and E are the commonest infections that we come across. Of course, with time, because of better understanding of hygiene and hand washing, things like that, the incidence of hepatitis A and E are going down. Okay. But nevertheless, we do get our cases in the hospital with very severe liver infection. Okay. So they are viral illnesses affecting your liver. Usually they're mild, but in some cases, they can be very severe and life-threatening. Okay. And as I said, they spread through contaminated food and water and associated very poor sanitation, unsafe food and water, and poor personal hygiene. As mentioned, it takes a virus to kick in. So, जैसे बोला कि आज आपने खाया है और कल हो जाएगा, ऐसा नहीं रहता है. You have to go back in time, try and remember what you had, let's say, a few weeks back. Okay, and that of course can be very, very relevant for us. Okay? So common symptoms for jaundice, dark urine, light stools, lot of nausea, vomiting, retching, loss of appetite, and as I said, extreme tiredness and fatigue. Okay. So generally, when a person comes to us or any doctor for that matter, हम थोड़ी basic test मांगते हैं. इसमें से हम enzymes देखते हैं, liver enzymes जिसको हम बोलते हैं SGOT, SGPT, which can be very, very high, can be in thousands. Okay. The bilirubin and echinor का एक blood test होता है. So are you seeing something? If you want to speak, you can just unmute yourself and talk if it's okay with me. All right. And if I'm going too fast or too slow, please tell me. Okay. So, and of course, हम लोग ये specific antibodies हम check करते हैं. ठीक है. ऐसा sonography हम सिर्फ मांगते हैं, मगर उसमें कुछ आता नहीं है. Treatment is very simple. Complete bed rest. Okay. Plenty of liquids to drink. एंड अगर इम्प्रूवमेंट नहीं होता है तो फिर हम बोलते हैं एडमिट हो जाओ करके. एंड एडमिट में हम लोग IV फ्लूइड्स देते हैं, पैरासीटामोल देते हैं, एंड सपोर्टिव ट्रीटमेंट मल्टीविटामिन वगैरह देते हैं. दो टर्म्स हम लोग यूज करते हैं, इंटरचेंजिंग करते हैं. वन इज कॉल्ड डायरिया, वन इज कॉल्ड डिसेंट्री. उसमें एक स्लाइट डिफरेंस रहता है फ्रॉम द मेडिकल पॉइंट ऑफ व्यू. डायरिया दोनों में लूज वाटर होता है, लूज वाटरी स्टूल्स होते हैं इनफैक्ट. एंड इन डिसेंट्री ऑफ कोर्स देयर इज ब्लड. Okay, so dysentery is considered a more severe infection. Okay, so usually diarrhea is mild to moderate and may not require hospital admission. Usually people with dysentery require hospital admission. Okay, the important thing in dysentery is it is a severe infection and it can cause anemia. An example of diarrhea is typhoid and cholera, while amoebic dysentery is a type of Sorry about that. Okay. अभी जो फैला हुआ है काफी लास्ट 3 हफ्ते में, we are seeing a lot of viral infection. Okay, and different types of viruses you can see. norovirus है, rotavirus है. तो usually ये ना बच्चों में होता है and बच्चों से adults में spread होता है. Okay, so if you are having any viral infection, just find out कि आपकी family में कोई young children है कि नहीं, and whether they have got it from their school buddies essentially. Okay. The main symptoms are watery stools, vomiting, and stomach cramps. Okay. Again, the treatment is very simple: bed rest, plenty of fluids, and चाहे तो क्रोसिन या डोलो आप दे दें अगर बुखार वगैरह होता है. Generally हम लोग admit नहीं करते हैं, ओनली इफ यू फील कि पेशेंट का ब्लड प्रेशर ड्रॉप हो रहा है या इतना डिहाइड्रेशन हो गया कि यूरिन बरोबर से नहीं बन रहा है, देन ऑफ कोर्स वी से चलो आपको एडमिट करके वी गिव यू फ्लूइड्स, ओके, एंड पैरासीटामोल, ओके. सो इफ अ पर्सन इज हैविंग सीवियर डायरिया, काफी बुखार आ रहा है, टायर्डनेस वीकनेस लग रहे हैं, चक्कर आ रहे हैं, क्रैम्प्स हो रहे हैं, तो फिर हम बोलेंगे यू नीड टू गेट एडमिटेड, एंड ऑफ कोर्स देन वी स्टार्ट यू एंटीवायरल ट्रीटमेंट, एंटीबायोटिक्स टू ट्रीट दिस इन्फेक्शन, ओके. एंड एंटीबायोटिक हम सब में नहीं देते हैं, ओनली हमको लगता है कि ये वायरल इन्फेक्शन नहीं है, बैक्टीरियल इन्फेक्शन है, जैसे अमीबिक डिसेंट्री है या टाइफाइड है या कॉलेरा है, तो हम ट्रीटमेंट देते हैं, अदरवाइज नहीं. एक इंपॉर्टेंट चीज बोलना चाहूंगा कि ना, प्लीज डोंट टेक इमोडियम एज एंड व्हेन नीडेड करके, बिकॉज जब डायरिया होता है मतलब इन्फेक्शन हुआ है, एंड द डायरिया हैज टू कम आउट, द इन्फेक्शन हैज टू कम आउट. सो कई बार लोग है ना इमोडियम ले लेते हैं, डायरिया तो बंद हो जाता है, बट द इन्फेक्शन गेट्स वर्स, ओके. So again, very careful about taking Imodium है या Ridol है या similar medicines which can stop your diarrhea but will worsen the infection. So how do you prevent these infections? Okay, so the most important thing is to try and break this chain. Okay, so generally contaminated food and water because of leakage of fecal matter in the water supply or the food that we eat. ओके. नाउ मॉनसून में ज्यादा क्यों होता है? बिकॉज अनफॉर्चुनेटली सब जगह पानी पड़ा रहता है, मक्खियां बहुत हो जाती है, ओके, एंड फ्लाइज आर अ मेजर सोर्स ऑफ स्प्रेड ऑफ दिस इन्फेक्शन, ओके. सो अगेन यू नो यू हैव टू मेक श्योर कि आपका खाना खुला नहीं पड़ा रहे, मक्खियां नहीं हो, सिंपल थिंग्स लाइक दैट आर इनफ टू रिड्यूस द चांस ऑफ इन्फेक्शन. एंड ये अलग अलग है, जैसे ये फूड हैंडलर से. सो अगेन यू नो आप स्विगी से ऑर्डर करते हैं, जोमेटो से ऑर्डर करते हैं, यू बी वेरी केयरफुल दैट द फूड हाइजीन इज मेंटेन. द फूड चेंज जो होता है कि खाना कहाँ बन रहा है, हु इज पैकिंग द फूड, हु इज टेकिंग द फूड, हु इज गेटिंग इट हियर, नीचे आपकी सिक्योरिटी गार्ड को दे रहे हैं वगैरह वगैरह, वेदर द पैकेजिंग इज डन प्रॉपर्ली और नॉट, whether it's open food or closed food, that makes a huge difference to you having infection. Okay, make sure the food is hot and hygienic. That is the most important thing. You know, sometimes some people of course make food in the morning, some restaurant, and give it to you in the evening. That is a big no-no. So make sure that that is not the case. Okay, now you know, if in fact if you like order something from the South Indian restaurant, you know, sometimes they make the chutneys and sambar in the morning, and when you order in the evening, sometimes they will reheat the chutney and sambar and give it to you. So you'll be very careful about all these because already इसमें बैक्टीरिया रहते हैं, एंड जब आप उसको रीहीट करते हैं तो काफी सारे टॉक्सिन्स निकल जाते हैं उसमें से, एंड विच यू व्हेन यू ईट यू एंड अप विद वेरी सीवियर डायरिया. ठीक है. So the most important you know thing which can reduce or prevent infection is hand washing. Okay, you have to keep on washing hands. जब भी हम you know अपने there is a strong Indian tradition of washing our hands before you know, we sit down for anything, any breakfast, lunch, dinner, जो भी लेते हैं हम लोग एकदम हाथ धोते हैं, and there's a big reason behind it is that you reduce the chance of infection by almost 90%. Okay, and that's a huge thing. Okay, एंड उसके ना अलग अलग स्टेप्स रहते हैं, इसमें ये नहीं है, बट ऑफ कोर्स यू हैव टू, देयर आर 6 or 7 स्टेप्स ऑफ वॉशिंग, एंड अगर आप गूगल करके देखेंगे दे विल टेल यू कि यू नो हाउ टू वॉश योर हैंड्स. ओके, बट बी श्योर यू हैव टू वॉश योर हैंड्स फॉर एटलीस्ट 20 seconds. ओके, एंड उसके बाद में अच्छे से रिंस करना है, यू शुड ड्राई इट वेरी वेल, एंड ऑफ कोर्स यू क्लीन द टैप ऑल्सो, क्योंकि आपके गंदे हाथ लगे हैं उसके ऊपर. ठीक है, इट आर ऑल वेरी इंपॉर्टेंट थिंग्स, बिकॉज कई बार आप बोलेंगे हमने हाथ धो लिया फिर भी हमको इन्फेक्शन हो रहा है. सो दिस इज समथिंग यू नीड टू रिमेंबर. Drinking water generally in Bombay, the municipal water is very good. Okay, chances of, unless there is a leakage in your drainage pipe and there is some of contamination, आपका जो drainage pipe है और आपका जो water pipe है उसमें कुछ mixture हो गया तो बात अलग है. But generally the municipal water which comes from the Bombay Municipal Corporation is usually very good. Okay, the general advice is of course boil the water, especially in monsoon season, or at least use some sort of filter. Okay, and there are two main types of filter: RO treated and UV light filtered. Okay, now in Bombay UV treated water is enough. Okay, because जो RO treated रहता है generally it's for smaller towns and villages जहाँ पे there are more solids present in the water that is supplied to you. Okay, but in municipal corporation from Bombay usually the solids are already removed. तो अगर आप यूवी लाइट वाला फिल्टर भी यूज करेंगे, दैट इज मोर देन इनफ. ओके, नाउ मूविंग ऑन, आई विल जस्ट स्पीक अ फ्यू वर्ड्स ऑन गट हेल्थ. ओके, व्हाई इज गट हेल्थ इंपॉर्टेंट? Okay, now there is something called as gut microbiome. I don't know whether you heard this term or not. Okay, so gut microbiome basically हमारी जो intestine रहती है, especially small intestine, उसमें करीब there are billions and billions of bacteria. Okay, and actually when you are born there is no bacteria when you are born, but as you grow up with a lot of food interaction with other people, you know, breast milk है, cow's milk है, जो भी है, धीरे धीरे हमारे इंटेस्टाइन में बैक्टीरिया डिपॉजिट होते रहते हैं. ओके, एंड दे you know, they are like in lot of symbiosis with the intestine. They don't irritate your gut, they are just there, they are just sitting. Okay, most of the bacteria are harmless, वो बस बैठे हैं, कुछ नहीं करते हैं. Okay, some are good and some are bad, and generally the ratio when it changes, अगर bad bacteria बढ़ जाता है, then we have a problem with your gut health. Okay, what is the role of gut microbiome? This is an ongoing thing. हम लोग इसके बारे में अभी बहुत पढ़ाई कर रहे हैं कि इसमें gut microbiome का क्या रोल रहता है. Okay, so of course the important thing is it helps in digestion of your food. Now certain bacteria will contain certain enzymes which will help in digestion of your food. Okay, and affects the hormone system of your body, and which in can affect your bones, your thyroid, your sugar, and even your mood. तो कई बार आपको लगता है कि यार मेरा पेट अपसेट है, एंड यू गेट मोर इरिटेबल, यू नो, आपको ब्लोटिंग हो गई, आपको गैस हो गया है, आपको नींद बरोबर से नहीं आती है, आप यू आर इन अ बैड मूड, इरिटेबल मूड हो जाता है. ओके, दिस इज ऑल वी थिंक इज रिलेटेड टू दिस गट माइक्रोबायोम. ओके, द इंपॉर्टेंट थिंग इज कि 70% ऑफ योर इम्यून सेल्स आर इन द गट. हमको लगता है इम्यून सिस्टम बोन मैरो में रहता है, स्प्लीन में रहता है, लिवर में रहता है, बट 70% ऑफ योर इम्यून सेल्स आर इन द गट. Your gut is the first line of your defense. हम कुछ भी खाते पीते रहते हैं, 90 to 95% हमको कुछ नहीं होता है, because the gut acts as a barrier. Okay, it just prevents the bacteria or the virus from traveling from the gut into the blood. Okay, and that's a very good thing. इसलिए gut health maintain करना बहुत हमारे लिए जरूरी हो जाता है. Okay, so what is dysbiosis? Dysbiosis is जहाँ पे हमारा जो gut microbiome है वो चेंज हो जाता है. Okay,